I suspect your dog has immune-mediated hemolytic anemia.
Wait, what?
Immune-mediated hemolytic anemia is part of the system of hemolytic disease that can be subclassified as intravascular, extravascular. Extravascular hemolysis results in
Too much information? Too complicated? Well, good news. I'm Davina, and I'm here to explain everything you need to know about this disease and how you can care for your dogs in the best way possible. First things first, let's break down the word. Hemo means blood, and lytic means lysis, or break down. Anemia is a condition where there is a lack of red blood cells. So hemolytic anemia is a condition where lysis of red blood cells occurs. Immune-mediated just means the immune system is causing the hemolytic anemia. The immune system is quite complex and equipped to fight off millions of pathogens or foreign materials that may enter your dog's body. A healthy immune system can also remove damaged or infected cells, like red blood cells. When a dog has immune-mediated hemolytic anemia, the immune system is confused and eats damaged red blood cells and healthy red blood cells. Red blood cells circulate in the blood vessels, but can also move into the other organs, like the liver or the spleen. When red blood cells die in the blood vessels, it's called intravascular hemolysis. When red blood cells die in tissues and organs, it's called extravascular hemolysis. The mechanism by which the immune system kills red blood cells is through antibodies, which are created by B cells. The red blood cell has antigens, or proteins, on its surface, and the antibody is able to bind to the antigen. This causes hemolysis, or cell death. Antibodies can be made by the red blood cell itself, or they can be acquired through a disease or a toxin. If the red blood cell makes the antibody, it's called primary immune-mediated hemolytic anemia. If the antibody comes from a disease or toxin, it's called secondary immune-mediated hemolytic anemia. Things that cause secondary IMHA are infection, cancer, drugs, and toxins.
So my dog has all these red blood cells dying? That can't be good.
Well, it's not. So what happens is red blood cells carry oxygen to different places in the body. So if you don't have enough red blood cells, then you don't have enough oxygen carrying capacity. So that's why you're seeing things like tiredness, shortness of breath. His gums were really yellow and so were the whites of his eyes. And these are breakdown products of all of these destroyed red blood cells.
So Dr. Rebecca, how do we know for sure that my dog has IMHA?
Well, it's going to take a couple of tests. First, we're going to in-house run a PCV total solid, so a packed cell volume. We're going to submit something called a CBC, or a complete blood cell count, and we're going to look for spherocytes. As well, we're going to do something called a slide agglutination test.
A normal red blood cell has an indentation in order to increase the surface area for absorbing oxygen. When a dog has IMHA, the spleen can bite off portions of the red blood cell, turning it into a spherocyte. Spherocytes are more spherical and lack the indentation in a normal red blood cell. In an autoagglutinated blood smear, the antibodies cause the red blood cells to stick to each other. In blood smears with no autoagglutination, the red blood cells don't have any antibodies, so they just spread evenly throughout the sample.
So if you have an anemic patient and you see spherocytes and autoagglutination, then it's highly likely that we have IMHA present. The next step, once we've confirmed IMHA, is what's causing it? Is it primary or is it secondary to another process?
Remember, secondary IMHA is caused by a handful of diseases or toxins.
My name is Sandra Powell, and I am owner and president of LifeStream. So today I would like to talk about immune-mediated hemolytic anemia in dogs. So at LifeStream, what we do is we provide safe blood products for dogs when they're in need of transfusion. If we had a unit of whole blood, what we would do with a unit of whole blood is we would take that whole blood and we would spin it in a centrifuge, much like this one. So the whole blood would go into the centrifuge, be spun down, and then would be in components of the canine packed red blood cells, much like this unit, and plasma, like this unit. Dogs with immune-mediated disorders require the canine packed red blood cells.
Aside from transfusions, dogs are often treated with immunosuppressive drugs, which block the immune system from killing red blood cells. Fortunately, there is active research being done in the area of standardizing diagnostic tests and in standardizing case studies. We're working on finding more effective ways to treat this condition. Recent research shows that therapeutic plasma exchange could be a new alternative treatment for patients with IMHA. Hopefully this video helped you understand what exactly is happening inside your dog and gives you hope that we can one day find the cause of IMHA in order to prevent it.